Good evening, everyone. Welcome to Intelligent Healing by StellaLife. My name is Anna. I am a product specialist with StellaLife, and I'm super excited to be hosting this meeting for you all this evening. Thank you for finding the time to join us to learn more about StellaLife, and I hope this is going to be an exciting hour for all of us. There is certainly going to be a lot of information shared with you tonight. With me here today, Emily and Rachel, my colleagues from StellaLife, who will be helping us to run this live learning session. Feel free to post questions in the chat box. If you'd like to interrupt with questions, that's fine as well. Just raise your hand and Emily or Rachel will assist with that. We certainly want to be getting all of this information out to you within an hour, but I'll be happy to stay around afterwards if you have more questions and you would like to dive deeper into any of the topics that we will be covering tonight. So once again, thank you so much for finding the time to learn about StellaLife products, and let's dive in. I am going to begin sharing the screen with you. You should already see that. Hopefully you can see it clear and bright on your screens. Tune your volume and let's dive in. We're going to be talking about quite a lot of different things today, focusing on a few questions that will guide our learning today, such as why use StellaLife in your practice, why consider that for your patients, the science behind it, what kind of procedures and applications we can apply StellaLife products with, how to incorporate it into your practice, why use our probiotics and Denta Medica, and how we can help elevate your practice as a whole with StellaLife products. But before we begin, I want you to think about something. I want you to think about the following question. Why do you think patients choose you? There are definitely many professionals in the field, right? But they specifically choose your practice. They choose you to treat them. They put their health in your hands and they come to you. So while we are learning about StellaLife today, I want you to keep that question in mind and we'll come back to it towards the end. So why specifically you and your practice and your team? We started our journey a little bit over 19 years ago with a very important mission. Our goal is really to improve people's lives by accelerating healing, relieving pain, and reducing the need for steroids and opioids. We've been on the market with our product for over a decade now, and we're seeing phenomenal results. We've been able to help hundreds of thousands of patients, working with thousands of offices nationwide, and also with quite a few of them overseas. And this is what we are seeing. We're seeing great results. We are seeing and we're being awarded as a top winning product for the past 7 years by Dental Advisor and quite a lot of other evaluators, that this is a product of choice by many of your colleagues, by many clinicians, as well as by patients. So stay tuned, get your coffee, get your tea, get your water bottle, and let's dive in and see what is that we have to offer for your patients. What can we do for them? We'll start with our very first product here on the left. It's our antibacterial antimicrobial rinse. Our products are all based on plants and minerals. So we focus on plant and mineral components to help your patients heal faster. So our rinses look like this. This is the size of the bottle, 16 ounces. We have 3 different flavors, and they are going to help get rid of the bad bacteria in your patient's mouth. And they're also going to do quite a lot more. So stay tuned to learn more about them. Then we have our gel, our anti-inflammatory gel, which you will be applying chairside as well as sending your patients home to use it at home. And then we do have our recovery kit, and that kit is a bundle of the rinse, the gel, and one additional item, which is the spray. And we're going to dive into these products in a few slides and see how these products help your patients in their treatment. All of our products are designed to relieve pain, decrease swelling and bruising, accelerate the healing process, and reduce the need for steroids and opioids. And this is where we partner with you to really help your patients heal in the fastest way possible with all plant and mineral based products. So, what are these procedures that we can help your patients with? Let's see in which areas we are able to help your patients: oral surgery, periodontics, general dentistry, orthopros, myofunctional therapy, oral systemic practices. So, procedures such as bone grafting, tissue grafting, implant placement, quad dentistry, extractions, SRP procedures, all of these procedures were able to help support their healing process and really promote that in the best possible way. Also, we are able to help your patients with some common concerns such as dry mouth, oral inflammatory conditions, mucositis, lichen planus, cold sores, kinky sores, so on and so forth. Aside from a topical product, as we were developing as a company, we also looked into the systemic approach. We do understand that everything starts from within, and we really are hoping to partner with you in that area and help your patients systemically as well. So we have our spray that comes within the recovery kit that helps with systemic pain relief. We also have our probiotics and Denta Medica supplements, which we will be uncovering in just a little bit. Let's start with the rinses and let's look into the research. We do have a lot of research, and that is something that we definitely won't have enough time to cover everything in 1 hour today, but we will share the links with you today. At the end of the learning, we do have your contact information, so we will be sharing this with you. And also, this webinar is being recorded for your reference, so you can share it with your teams, you can share it with your colleagues, and we are going to be able to help. Let me see. I see we have a little bit of a chat coming in, or we can continue. Sorry about that. So let's dive into the research. Why use StellaLife rinses instead of chlorhexidine-based rinses? Yes, we do know chlorhexidine has been a gold standard, but we do have a lot of data now that much more than what we had in the past to see that there are better alternatives. This study in particular was done at the University of Bern, which is one of the leading universities in that area in the medicine in the world. And what they did, they compared and contrasted StellaLife rinse with chlorhexidine. So what you see on your screen right now is some data from that research. Feel free to scan the QR codes on your screen. That will take you to the full length study, but we will also be sharing this with you. So don't feel if you missed the slide that you are missing the information. We'll definitely share that with you at the end. So this study is showing us the green dots on the screen are the alive cells and the red dots are the dead cells. What's happening when you're swishing with chlorhexidine? You're going to be very drastic. You're going to remove everything from your patient's mouth. You're going to get rid of the bad bacteria, but also you're going to get rid of the good bacteria. And you're going to stop the cellular proliferation process and kill that fibroblastic activity, which is so much needed for your wound healing process. So what you can see with StellaLife, swishing with 1 minute allows you to target the bad pathogens, but we are not going to kill that good commensal bacteria, for instance. So we're not as drastic, we are not going to be as aggressive in that healing process, and we are not hurting the human gingival fibroblasts, which is exactly what you need for your wound healing. You need that fibroblastic activity, right? And that's where we come in, and we have a different approach than chlorhexidine based rinses. That's why many of your colleagues and many of your patients are going to be choosing StellaLife over chlorhexidine based rinses. Now, another study right here down at the University of Texas in San Antonio, if you recognize the clinicians who conducted that study, they are leading clinicians in the field, Dr. Georgios Katsakis, Dr. Pikas. So what they wanted to see is actually how the wound healing is happening, and compare and contrast it again with chlorhexidine treatment and StellaLife. So we're going to enlarge this a little bit so we can see this better. You can see here scratch wound assay, right, under a microscope. There are two samples in here. Chlorhexidine is in the middle for both of them, control group on the right and StellaLife on the left. So what are we seeing in here? That black area is your open wound. Note that with chlorhexidine, even after 50 hours, you're still going to see that wide open area. There is nothing happening in there. It's not closing. Whereas with the control group where they use salt water and with StellaLife, you can start seeing those white fuzzy things on the screen around the period of time around 20 hours. So what you're seeing is much faster wound closure. With StellaLife, around 48 hours, you can see that the wound is pretty much closed. That's how we are accelerating the wound healing process, right? And that's where we come in and help your patients to experience less discomfort and faster healing. I wanted to go back to these circles on the bottom here and show you that when you have a darker circle there, that means that you have more cellular activity. This is exactly what we need. So look for chlorhexidine and Listerine. You don't see that much of the cellular activity in there, right? It is very bright. Whereas for StellaLife in the control group, we do see that pretty dark. That means there is a lot of cellular activity in there. So moving forward, there is, as I said, a lot of research in there, but here's another study that we would like to take a peek at. Indiana University, they compared and contrasted a few products in there, chlorhexidine, iodine, StellaLife Gel, and Peria Sciences. And in their conclusion, you see that they are indicating that they state that StellaLife has demonstrated no determinal effects on human gingival fibroblasts, which is what we need for the wound healing. So this is why many of your colleagues are choosing StellaLife. Every time we do a live learning session, there's a lot of interest from the hygienists, from the team members asking what kind of bad pathogens can we control. And here's a study done by Rutgers University where they're showing that we are able to control the FN bacteria up to 12 hours. FN is a tricky one, right? And it is also a carrier for other bad pathogens. So if we are able to control that, can you imagine how much we're doing for your patients? We are able to control the P. gingivalis up to 96 hours, and we're not hurting that good commensal bacteria, which is responsible for blood pressure levels of your patients. We don't want to hurt that. And while doing that, we're also disrupting biofilm. So this one rinse is actually going to be able to help your patients in so many different ways. We call it, a multifunctional solution. Earlier, I showed you 3 bottles, so it's not just one rinse that we have available. We have 3 different flavors. This one particularly I'm holding right now is a coconut. Then we have a spearmint, then we have a peppermint. They are identical in their efficacy, whereas coconut is slightly more soothing. So I want you to think about your extra sensitive patients when you're considering these rinses for your patients. Those might be your oncology patients, those might be your xerostomia patients. They might be too sensitive to the mint. Not everybody loves mint, right? And some people cannot tolerate mint. So we went ahead and we listened to the feedback of your patients and we developed that coconut rinse specifically for them, adding a few additional active ingredients for the soothing effect. And here's where I would like to pause for a second and ask for your feedback moving forward. Remember, we are a relatively small company, we're a relatively new company, and that's where we are able to make changes pretty much right away, and we are very proud of that. So when we initially developed our peppermint rinse, we heard the feedback from the patients who were saying we cannot tolerate peppermint, and we then went ahead and worked on a different flavor and developed the coconut rinse. We continue listening to the feedback, we continue improving, and we are continuing to develop products based on your patient's needs and based on your feedback. So your feedback is important and it is making changes. And that's where we really are unique in our approach, because we really want that feedback so we can continue helping your patients and continue improving. Now, nitric oxide is a big conversation, and there is a lot of talk about it right now, more than ever, I believe. And nitric oxide is essential for our health. And we do know that a lot of mouth rinses out there are going to kill that nitric oxide, and that is unfortunate. You can see here from the study and from the data on the screen, we are not killing nitric oxide, so it is absolutely safe to use for your patients. and they are going to appreciate it so much more. Now, many times we're being asked, are our rinses staining? Are they safe to use for a very long period of time? Absolutely safe and no staining. So yes, no staining with our rinses, and your patients can be using them on a daily basis for as long as they need to. So I want to bring your attention to another case study here done by Loma Linda University. This is a patient, a 47-year-old female with an oral pemphigus. You can see from the picture, she was not having a good time. We can see her gums. We can see what's going on in there. It is devastating. I can't even imagine how she was going throughout her day. So she was put on StellaLife coconut rinse in particular, and that's because, as you heard earlier, it has a little bit more of the soothing for those extra sensitive patients, and they did an SRP for her, so that it was the only treatment provided, SRP and StellaLife coconut rinses. And you can see she has been using our rinses for 3 years now, and she is saying that she'll continue using them. There was a period of time when she ran out, and during that time when she was not using the rinses, she said the flare-ups and there, some of the discomfort came back. So she is definitely using them regularly, because that's what's providing her with comfort, and that's what's going to what your patients will be thanking you for, because in these situations it's really hard to find the right solution for them, and we do have that, and we are very proud to be able to help those patients in particular. Here's another case here. We are looking at comparison again with chlorhexidine and StellaLife, and you can see once again, this is a gingivitis scenario. There is no staining with StellaLife. So while stains, are sometimes people say, well, we can just remove them, we can take care of that. But why even go in that direction if you can avoid them to begin with? You can provide your patients with the same care and even better care without any staining. So no chair time to waste, no patients unhappy because they have stains on their teeth and they don't want to smile. Let's keep your patients happy and healthy. And now let's look at the aspect of reducing the pain, right? So we do have our recovery kits, and the recovery kit is consisted of 3 items in there. So it has the same peppermint rinse. It comes perfectly fitting here in the box. Then there is the anti-inflammatory gel and the spray that are fitting in there. And these items are going to help your patients in their process of healing. So you can see here Dr. Walter Tatch, he is an oral surgeon who started using StellaLife products back in 2015, and within the first 2 years that he incorporated the regimen of the recovery kits in his practice, he was able to reduce the prescriptions of opioids by 73%. So remember our mission. This is where we come in and partner with you to reduce the prescriptions of opioids and pain medications when we are able to help your patients in a more natural way with the rinses, the gel, and the spray that we have for them, and other products as well. And here's another study to support that. Dr. Cameron Lee and Dr. Suzuki, they conducted that also back in 2018, 2019. They took patients after extensive surgeries, as you can tell from the image. They split them into 2 groups. They gave group A recovery kits. They didn't give the recovery kits to group B. And as you can see from their conclusion, Group A that received the recovery kits reported lower pain intensity, used much less pain medications, and recovered faster. So who doesn't want that? That's exactly what we're able to provide your patients with, and what you now have available and will have available through your practice. Now, we love to support your teams. This is what we're all about. We are about partnership. We are here to develop materials for you, and we will work with you to make sure that your team is educated. We'll provide you with all of the materials that you need to be successful in incorporating incorporating the StellaLife products into your practice and sharing that information with your patients. So your patients are choosing your practice. I want to go back to my first question that I asked you earlier today. Why are they choosing you as their provider, right? So why are they choosing your office and not the office down the street? And we develop materials for you to educate your community of patients of what you are able to offer to them. And you can look at one example here, pain management office protocol. You see, we do that for you. You can put it on your website. You can let your community of patients know that you take a stand against opioids, that you have another alternative in your office, and you are investing in their health and you're investing in their care. And they truly appreciate that. Now, let's watch a short video courtesy of Dr. Picos, a world-renowned oral surgeon, who is going to share with you how he is using StellaLife Recovery Kits chair side, how he's applying the gel chair side. So stay tuned. He's showing you one method. He is describing a different method. And then we're going to discuss the 333 regimen that he's going to mention in the video as well. So just a few seconds here. Let's watch this together.
There's a 333 regimen we talked about. It's very impressive. Here's a typical V-plasty with Eloderm, time 0, there's 5 minutes. Hemostasis is like boom, amazing. But keep gauze on it for a good 4 minutes by the clock. That's the key to low compression, and let it soak in, and bingo. Here's a case of just cytoplast over extraction sites. You know, again, tissue is beautiful, responds very, very nice. And then here's our typical, 48 hours later, that's what things look like. Very typical. It's amazing.
Okay, I just want to address a question that came in the chat quickly here because we are going to dive into further conversation, further topics. I'm going to go back to that scenario here and answer the question. Yes, we did recommend the coconut rinse, particularly for this case. I was pointed out that I cut off for a few seconds. The coconut rinse was much better for this patient. We do recommend that because it has more soothing in there. Absolutely. And keep those questions coming. Thank you, Rachel, for pointing that question to me. And we'll continue answering them as we go. So what Dr. Picos was sharing with us is that the 333 regimen of the recovery kit, which is right here, is what he recommends for all of his patients who go through surgical treatment. So what are these numbers? What do they stand for? We have 3 products inside of the kit. We want the patients to start using it 3 days prior to the surgical procedure or prior to SRP. And then we do want them to use the products at least 3 times a day. Sometimes it is 4 times a day. Sometimes patients are in a little bit more discomfort and they want to use it 5 times, 6 times a day. It's absolutely fine, but at minimum is 3 to 4 times a day. All 3 products in this order. So they will rinse, they will swish for about a minute. There is a measuring cup inside of the box. Every rinse comes in with a cap with a measuring line, and they only need 7 to 10 ml. They will swish for a minute, they will spit it out, then they will take the spray, 4 sprays under the tongue, and then they will apply the gel topically with the cotton swab, and they will do it on the treated area or on the area that will be treated. So when they're doing it prior to the surgery, that will be on the area that will be treated, and obviously post-surgery where the surgery was performed. We do ask that patients don't drink or eat for 20 minutes post application of our products. Remember, our products are topical products, and that is important that it stays in their mouth without being washed off by food or drinks. So the best time to do it is before bed. Hopefully your patients don't eat or drink while they're sleeping, and the product can stay active in their mouth for hours, and that's where it actually is going to be most productive. But then when they do it throughout the day, of course, again, 20 minutes afterwards, at least that would be best for the patients. Now, I'd like to go back to this visual right here. My apologies, right here. So you see some examples of before and after, and you can see what our products are able to do for the patients and for the procedures you do in the office. So post-op on the left bottom right here, all on six, looking great already. The side is looking really good. But then look to the right of it, only 40 minutes later with one application of the gel. Look how the tissue is looking much less swollen, much less bleeding. It is tightening. It looks like it has been recovering for hours, and it has been just 40 minutes. The top image is a sinus lift ridge augmentation, a split mouth case, same patient, same procedure. On the left side from the dotted line, we applied the gel. On the right side, we didn't. You can tell the difference, right? So we definitely are making a difference. We're definitely seeing better results. Even if your patients are naturally recovering great and they are not experiencing a lot of discomfort, it is still going to improve that process for them. It is going to make it better. So why not offer that to them? The bottom case is an impacted canine with a cyst removal and bone grafting, and you can see that side of 1 week of recovery. You can barely note any surgery being done in there, and that is again with the recovery kit. That's what your patients are using for the whole period of time for their healing process after the surgical procedure, and very much important to do it 3 days prior to the procedure as well. So how long they will be using the product for afterwards until they're healed? Typically we see it about 7 to 10 days, sometimes a little bit shorter, sometimes a little bit longer. But once they're done healing, they can continue, and they should be continuing using the rinse for maintenance, because the rinse is going to get rid of the bad pathogens in their mouth, right? And we all have that, and we want to maintain that area as clean as possible. But here's the great part, is that most of the time you don't even need to tell this to your patients. They really fall in love with the flavor of our rinses, whether they're using the peppermint, the spearmint, or the coconut. Those flavors are quite different than what you've experienced before, and we encourage you to try these and have all of the three different flavors in your practice, so you have a choice, so your patients have a choice, and they find that the flavor that they really tolerate better and like more. So if they like it, they will continue using it, and there is not going to be any issue, there will not be any issues with compliance in there. Now, here's another video that I'd like to share with you, and that one is a courtesy of Dr. Walter Tech. Again, application chair side, and this is immediately post. So let's see how he's doing it here. Walter Tech here. This is a case of all on six reconstruction with immediate temporization. We're going to apply right after the surgery StellaLife Vega oral gel over the surgical side with the suture line and then the vestibule. We bring the patient back 15 minutes later for delivery of the temporary prosthesis, where we're looking at the soft tissue. A week later, you can see the tissue is already responding very, very nicely. And that's what we really hope that you can start seeing in your practice as early as this week already. If you already have the products, if not, we'll work with you and we'll be able to send the products to you, and you can start implementing them right away. So now let's talk a little bit about non-surgical applications. What happens when your patients have different lesions, different sores from chemotherapy, cold sores, kinky sores, all of these. We're able to help those patients as well. Dr. Scott who is a phenomenal individual and a great clinician in the field, he has done some studies, and what he saw with our gels is that we're able to cure these ulcers much faster. We're able to do it in a very short period of time. So anywhere between 3 to 4 days, you'll see great results. And the best part about it, the gel has a little bit of a cooling effect. So when you apply it on a sore, you're actually going to have much less discomfort pretty much immediately. So you will experience better care right away as soon as you're applying the products. And who doesn't like that, right? Your patients will definitely appreciate that. So we are able to help those sores go away in a faster period of time, and also providing your patients with a care that is much less discomforting for them. Dr. Scott also did quite a lot of studies, and what he saw is that we we can reduce the need for adjunctive antibiotics during scaling and route planning, right? So some of your patients cannot tolerate antibiotics or they don't want to use them for this reason or the other. Obviously, that's something that you put your patients on, but we are able with the recovery kit to support their healing, and we're able to do it in a very nurturing
Anna,
way.
I'm going to pause you for a second really quick, and just request that if there aren't any questions that you just mute. It makes it really difficult for us to hear Anna. Thank you.
Rachel, I appreciate that. So if you heard Rachel, please mute yourselves if you don't have any questions, and better if you can put those questions in the chat, and we will definitely address them as we go. So going back to scaling and route planning, we do recommend that you use the products chair side. You will be using the rinse and the gel. We don't recommend that you use the rinses into any irrigation system, but instead please use an endosyringe or a measuring cup for your patients to swish and spit out the rinses when you are irrigating with the endosyringes. That is also something that you can see the difference right away. I've seen a lot of clinicians using the rinse during surgical procedures, during treatment, during SRP, and they are applying it all over with the syringe, and it is helping the tissue, it is helping the process, it is cleaning the area, and it is providing your patients with better care. And then you would take the gel at the end of your procedure, like your signature line, right? Your stamp at the end, and you would apply it all over the area that you treated and let the products penetrate the tissue. The gel will be there, no washing it off. It is really staying in there. Your patients are walking out of the office and it is already taking effect, and it is already helping the healing process for them. And then they will continue at home. Remember, they will take this recovery kit home and they will continue using it for the following 7 to 10 days, following the protocol. Remember those images from before, they are printed for your patients right on the box, so it is easier for them to remember, and they will continue this protocol. There are also QR codes on most of our products, if not on all of them already, and that is to guide your patients. If they just want to scan the QR code, it will take them to our website, and there are application videos. There is more explanation in there, and patients really appreciate that because many times patients don't want to read anymore. They just want to see a video, and that is available on our website. Just send them there and they will get that information. Now, I'd like to share with you a little bit more on the rinses. You can see that we're able to help your patients. We're able to reduce strep mutans, P. gingivalis, and other bad pathogens. And that study is also available online on our website, done by independent lab and microchem lab. So you can go dive in and learn more about the different things that we can do for your patients. Let's talk a bit about your patients with halitosis, your patients with dry mouth. Yes, it is the same rinse. So again, going back to multifunctionality of our items, we are really helping your patients in so many ways with the same products that we have. So halitosis is definitely going to be the rinses, and the next product, without spoiling it, is going to be the probiotic that we have available for your patients. Dry mouth is any of our rinses, really. We're able to hydrate. We are really proud to be able to help your patients who have dry mouth, and our rinses are supporting their overall health and reducing that dryness that they're experiencing on a daily basis. So if they're using it, they're going to be experiencing much less of that, and will come back sometimes and tell you they don't have dry mouth anymore. That can happen. As long as they continue using the rinses, they won't be experiencing that much of the dryness and those symptoms. Dry sockets and any type of appliances. So dry sockets, we're able to help your patients with the gel and the rinse combination. If your patients ever have that, this is the protocol, and you'll see it. We are not just going to leave you hanging like that, remembering all of the information. We developed cheat sheets for you. We have clinician guides, and I know because of my background, it's kind of hard to see that, but we will be sending these to you to have those in your office so you can refer to them anytime you are trying to remember which product are we using for which scenario. So in this case, rely on these cheat sheets that we've developed for you. We have some mapping pages here, the patient's guides, and all of that will help you identify which products to use for what scenario. Let's go back to any type of appliances. We do recognize that patients with appliances, first of all, we need to maintain that area clean, and it's sometimes harder because of the appliance, because they cannot get to every single point in there. So the rinses will be essential in that treatment, whether those are ortho appliances or permanent appliances. Any type of appliances your patients have in their mouth, with the rinses, we will maintain the area cleaner and healthier for your patients, and that is going to lower the risks of any types of infections moving forward, right? Then the gel is going to make this process more comforting for them. So sometimes the appliance is rubbing against the tissue, sometimes there is a little bit too much pressure, sometimes something is accumulating in there. So with the gel, we can help that tissue stay healthy, nurture that, so that appliance is not causing any discomfort for your patients and any negative outcomes, of course. Like in plantar scenario and some of your autoimmune condition patients, they come to you and they say, what else can I try, right? Or it's devastating for them, they have to deal with these scenarios. And this is where we come in and we can say that we can help most of your patients. Yes, most of your patients will benefit from using our products, and we're able to help, like in plantar scenarios. You can see here, this female patient was not having a good time, right? You can see that from her gums. You can see that they were not comforting at all. And then she was put on StellaLife regimen, which is the recovery kit 3 times a day. We do recommend using the coconut rinse for lichen planus patients as well, so that it is more comforting for them. And you can see the difference within 1 week. This patient came back. I had a pleasure of talking to Dr. Sheldon, who had this case report, and he said, I've never seen her smiling before. And here she came in and she smiled and she thanked him because it was a life-changing experience. And it's not just one individual scenario. I cannot tell you how many emails we get and how much feedback we get from doctors and from patients directly, thanking us for developing this product, because it is a life-changing experience for them. And patients will go on and on writing and explaining what they went through and show how much we've helped them. And think about all of these patients. You are the person who is going to introduce this product to them. So they're thanking you. And we really want to support that relationship you're building with your patients by providing them with much better experiences. So we are not able to help all the patients because there is no one product that works for all. I wish there would be. That would be probably a miracle product, but we're not there yet. And if a patient is ever coming back and they are not seeing the satisfying results, and they're not happy, we'll take full responsibility for that. We do recognize that, it's important for patients to have the best experience. So we'll take care of your patient, we'll take care of you. Trust us, we'll guide you through that process as well. So mucositis scenarios, you can see that we're able to help those patients as well. Really, there are so many other applications that we're yet to uncover ourselves, and we encourage you to share with us the feedback that your patients are providing you with, and what you learn about our product in this journey together with us. Let's talk about,
Anna,
yes.
before we jump into probiotic, it looks
Mhm.
like we have a question in the chat.
Yes.
I'm interested in using them for tongue tie releases, but most patients are teens and kids. Do you have any recommendations or insight?
Great question. So, for tongue tie release, we would recommend the gel. We do work with a lot of pediatric offices who are using our gel for tongue tie. Now, we are an FDA regulated product. You'll see the NDC numbers on all of our bottles, indicates that we are FDA certified. FDA regulations require of all herbal products, there is an age limitation limit in there, and that is 6 years or older. So if your patients are 6 years or older, you're safe to go ahead and use the gel right away. If they're younger than 6 years, you need to have them consult with their primary care physician first. And that is up to the primary care physician to determine. You'll see the same regulation on a herbal tea, all herbal products regulated regulated by FDA will have the same thing. So Kim, I hope I answered your question, but we can definitely discuss it further. If you'd like to stick around after, I'll be happy to chat with you more on that. But really, the regulations are 6 years or younger, consult with primary care physician. And that is, by the way, also true to patients. If you are recommending our products for patients who are pregnant or lactating, it will be the same regulation. So pregnant, lactating, 6 years or younger, they should be consulting with their primary care physician first. But as I mentioned, yes, a lot of our pediatric offices who we work with use the gel for tongue tie release as well. Now, let's talk about probiotics. They are not less important than the rinses, the gels, and the recovery kits. This is a systemic approach. So while there are many probiotics out there, I believe personally is that there is yet so much to uncover about what probiotics can do for us. So let's consider the fact that we're all built out of billions of different bacteria, right? And oftentimes we have disbalance in our system of the bad and the good bacteria. So how can we promote patients' health? We can help them balance that better. Now, it is really surprising to me that there are so many oral probiotics out there and so many gut probiotics out there, and they don't talk to each other. We do understand the connection between the oral systemic health and your entire body. So we've developed a product that is going to restore the microflora in your patient's mouth and in their gut. So because they are connected, bacteria travels. We have to take care of the bacteria in your oral cavity and also in your gut together. So what you have in this package, you have 2 bottles in there, an oral probiotic and a gut probiotic, and they come in packaged very nicely like this. Okay, so what is so unique about our probiotics? Uh, Probiotic by itself is great, but it's not going to survive in your system without the prebiotic, without the postbiotic, and without the spore strains. So a prebiotic is the food of the probiotic, and the spore strains are actually making sure that the probiotic is surviving the gut acids, and it is helping to support that integration in there and for that bacteria to stay in there, right? That's why probiotics by themselves are not enough. We have to have a prebiotic and a postbiotic and spore strains. Here's another interesting thing. Most probiotics out there focus on maybe 10 essential strains of bacteria. That is the most that is available out there. Very few probiotics will go beyond that, but most of them go anywhere between 1 to 5 different strains. We have 17 essential strains, and that is really important because each strain is responsible for something else. And when we come in and we say we are able to help your patient in so many different ways, we're ought to consider the variety of products that we can put together and help your patients in that, a wide spectrum of different things that they're experiencing. So the Lactobacillus reuteri, for instance, is responsible for antifungal properties and gingivitis reduction, and it is really helpful in SRP. But it's not the one that is going to help your patients with halitosis. Halitosis is a different bacteria, right? So we need the Streptococcus salarivirus in there that will help with halitosis. So really, different bacteria strains are responsible for different things, and that's why we have this robust product in there that is covering so many different things for your patients with the same product. So oral lozenges, your patients will be taking it once a day, letting the lozenge dissolve in their mouth, and it is lasting about 5 minutes. The longer it is in their mouth, the better it is. The more they're going to have that bacteria, that good bacteria populate in there, and we're restoring the microflora there. And then with the gut probiotic, we're doing the same thing in their gut. Many times people have difficulty believing what probiotics can do for them because really it's hard to see it visually. But here's a scenario where you can actually see what probiotics were able to do for this patient. Look at this 29-year-old female, the pocket depths, the plaque that she had, the bleeding, and then she was put on the probiotic regimen, SRP, and you can see amazing results 6 weeks later. But what's more impressive is the maintenance with probiotic only. 4 months later, look at her gums. Isn't that impressive? Look at this data. Look at the really the reduction of probing depths and the bleeding and the plaque reduction. This is really impressive, and this is the probiotics that are doing that for you. So why not offer this to your patient? It's a big question. Um, who can benefit from probiotics? Anyone can, but specifically your patients who go through SRP, those who have surgeries, those who have halitosis, and really anyone can benefit from probiotics regimen. Now, let's talk about our last but not least important item, Dentamedica vitamins. And I'm really excited to share this with you for many reasons. But let's start with the very main reason. How many people do you think are vitamin D deficient in our country? I'll let you think about the number for a second. And I don't know if it is surprising to you or not, but 80 to 90% of our population is vitamin D deficient. Even if you live in Florida, because it is not so much from the sun, which is, by the way, a good component in there, but it is a lot from our nutrition. We don't get enough of vitamin D through our nutrition. And that is a big problem because vitamin D deficiency is so risky, and it is risky in so many different ways, but particularly when you have implant surgeries. So implants, right, they're integrating in the bone, and vitamin D is so important for bone and for tissue healing. And when your patients are vitamin D deficient, they are just going to be at risk of early implant failure. And you don't want to take that risk. You want your implants to stay there forever, and you want your patients to be happy. You don't want a patient calling you and telling you that it is not a good experience for them. So this is your insurance policy, really it is. What we can do with Dentamedica vitamins, we can boost your patient's vitamin D levels in a very short period of time. And how do we do that? We have a very interesting formula, and we are very transparent. You can see all of the products, all of the ingredients, and all of our products. By the way, if you turn around any of our boxes, you see all of the ingredients in there and what each ingredient is responsible for. We are that, we are fair game. So we show everything to your patients. So this is our formulation. As you can see, it's not just D3. It is the D3 and the Bs and the magnesium and the calcium and the K2. But what's really important, that is the source of the vitamins. So look at this. Our vitamin D is taken from lichen, which is a plant base, unlike most vitamin D out there that is being taken from sheep's wool. And that is not the best for the absorption of the vitamins in our system. So you probably have heard people saying, I take vitamin D on a regular basis, but I don't see my vitamin D levels are still low. They're still not going up. Well, that is probably because it's not being absorbed in their system. So, how can you ensure vitamin D absorption? You can really look into the source of the vitamins, and you need to make sure that it is supported by the cofactors, the ones that I just had in front of you right here. And here's another thing about our products. We do improve, and we did improve this version, by the way, which didn't used to be vegan, and now you can see it's vegan, it's soy free, it's gluten free. All of our products are manufactured in GMP facilities, good manufacturing practicing facilities. What that means is that they're being regulated and that every batch is being checked and is being checked for the efficacy. And that is really important because we work with plants and minerals, and we want to make sure that all of the products you're getting are high standard products. And that's sometimes also reflected in the cost of the items, though we do try to make sure that your patients can afford our products. Of course, that is really important for us and for you as well. So moving forward, how to use Dentamedica in your practice. If your patients are using it to boost their vitamin D levels up, it is the booster dose, 2 capsules with the first meal and 2 capsules with the second meal every day. So it's 2 and 2. And then if they're doing it for maintenance as multivitamin on a daily basis, they will cut that dosage. They will do with the first meal and 1 capsule with the second meal. So when they do it for the booster dose, it's 6 weeks worth of supply in this box. And when they do it for maintenance, it is 12 weeks worth of supply. And for all of the vitamins they're getting in here, it is amazing what these can do for them. And now we're getting towards the end. So, where can patients get our products from? Why join the StellaLife family? There are so many other perks why join the StellaLife family that we didn't cover here today, but I do want to point out this one in particular. So we do include you as one of the providers on our page. When patients hear about StellaLife products from a colleague, from a family member, they come to StellaLife.com. The first thing that they see is find near you. They click on that button, and I encourage you can go in there right now and just check it for yourselves. Who are the people in your area who already carry StellaLife in their practices? You'll be surprised to find that some of your friends or maybe your colleagues or somebody else is already incorporating StellaLife in their practice. And that is what your patients will see. Once you join the StellaLife family, your information will be there as well, your address, your phone number, and how to contact you. So when patients come and they look for their products on our website, they can actually go and get it directly from you. And we do hear stories from our clinicians that say, they called in, they asked for the rinse, they came by, they picked it up, and then they booked their next appointment with us. You never know. A patient might be new to the area. A patient their dentist might be retiring and they're looking for a new office, or you might be providing services that their dentist is not providing. So this is our opportunity to introduce you to patients who are looking for StellaLife products and have those products available to them through your practice. And we do a lot of other things. We also provide you with scholarships towards further education, towards courses. You might be interested in PRF education. You might be interested in facial aesthetics and other different courses available out there. And we have that opportunity to support your learning moving forward as well. So now I know we're getting towards the end, but I really wanted to share with you that there are so many other things that we can do for you. And we are going to be hosting these webinars periodically on different topics. So stay tuned. Next time you receive an invitation, please invite your colleagues, your team members to join us. I know it's 1 hour at night or maybe earlier if you are on the Pacific time zone, but it is so worth it. And the next topic will be something else, something different. So hopefully that was informative for you and you really enjoyed this session today. I certainly enjoyed being here for you and sharing this information with you. And we will be there helping your teams and supporting you once you choose to join our StellaLife family. Now, I do see there are a few questions, I think, in the chat. And let's see.
We actually got to all of them, Anna, in real time.
Really, really happy to hear that. But as I said earlier, I'll be happy to stick around. If you would like to stay, we can finalize this session and stop recording at some point if you want to chat, if you want to, explore further. But we will also go ahead and send this to you. And we will provide you with complimentary products as well. So just reach out to us. Attending this webinar gives you a lot of benefits as well.
Thank you so much, Anna. And thank you everyone for joining us this evening for Anna's StellaLife Live Learning. We appreciate you carving out this time. And shortly here, you should see a pop-up and we'd really love to hear your thoughts. So we ask that you just take a moment to give a little bit of feedback. It's only 3 questions and would really love your insight as to how helpful you found this session and any feedback that you'd like to share. We also in the chat dropped some links. So some links to the research that Anna shared, also our ebook. This is a great resource that covers everything from the science that Anna presented, as well as the different applications in one kind of convenient spot. So lastly, you'll see in what we put in the chat as a thank you, we'd like to, again, just echo what Anna shared, is that we want to send some complimentary products along with some reference materials. So you'll see an email in there. Just email info@stellalife.com and we can get everything set up. It does look like we have a few questions coming through, Anna. So the first question up is which scholarships? Can you provide a little bit of clarity on that?
Course. So when you go to StellaLife.com and you scroll down, you'll see many different institutes that we work with, and they provide wonderful educational courses. So if you're interested in one of these courses, please reach out to us. Scholarships vary. Some scholarships are $200, some are $300, depending on the course. Sometimes they're even, higher amounts, depending exactly when the course is taking place and which course it is. But we are always here to support your learning. So when you are able to just reach out to us when you're interested in the course, find out that course that you're interested in, reach out to us, and we will provide you with the code when you are registering. So remember to do it before the registration. And again, it's with all of the providers that you will see on our very front page. And I see another feedback in here, and I will address that. I did put my email in there, which is a Gorbikoff at StellaLife.com, and that is also specifically for a lichen planus question here, Carol. So I would love to chat with you and see how we can help you. And yes, the coconut rinse will be really helpful for lichen planus, the coconut rinse together with the spray and the gel. So if you can email me directly, I'll be happy to walk you through the process.
Thank you so much, Anna. And we also have an e-newsletter that goes out every week with new information, new innovations, and then also a reminder of different applications that you can use the Stella Life products. And in there, we also have some of the highlights of some of the scholarships that we offer with Dr. Picos and the Picos Institute, as well as PRF EDU and a lot of others. So we will be following up. You'll be receiving some of those. And please let us know if you have any questions along the way. We're absolutely here to help.